Let's talk about how is it that graduate programs can prepare graduate students for providing telemental health services. And to discuss this, I'm really glad to have with us Dr. Logan Winkelman. She is an assistant professor and program director for the Master of Science in Clinical Mental Health Counseling program at Texas Tech University Health Sciences Center. She has worked in higher education for over 9 years. Her scholarly interests include access to mental health and wellness resources through telehealth, emotional intelligence, biofeedback, aging, and longevity. So, Dr. Winkelman, thank you very much for being with us today.
Thank you so much. It is definitely a pleasure.
Yeah. And just to start, I was wondering if you could help us kind of get an understanding, like a picture of what the need is. What is the struggle? So, graduate programs for behavioral health have been going a certain way for a while. And now there's a shift with telehealth. And what is that need? And what's kind of been the challenge there?
Yeah, so I think that from our perspective, our program actually we had telehealth before as a focus in our curriculum before COVID hit. So our program is completely online, and we were training our students in telehealth. But then when the pandemic hit, I think it magnified the need, and I think it also opened people's eyes to just how possible telehealth and telemental health counseling can be and why it's so important. Whether you're an online program or a face-to-face counseling program or behavioral health program, the need for telehealth counseling skills for students is going to be present. It's not going anywhere. Telemental health is not going anywhere. And I think the pandemic just showed us how important it can be and how useful it can be, particularly um, for rural areas. Because, for example, where we're located in Lubbock, Texas, we're called the hub city. So we have a bunch of little towns all the way around. And before telemental health counseling services were really kind of pushed to the forefront, people would have to travel a couple of hours just to come to their appointments. And so I think with this being pushed to the forefront, it allows us to really start accepting it as a modality of counseling. Not necessarily a replacement, but just as important of a modality. And so training students, regardless if you have a focus in telehealth in your program, I think is essential because it's likely that at some point they will offer some form of telecounseling. So it's definitely important, in my opinion. It was important to us before the pandemic hit, but definitely now that we've seen how the world can change so quickly, we're so glad to have already had that kind of incorporated into our curriculum.
Yeah, so you guys were real forerunners. I mean, you were already providing telemental health training in your program. I know by far most programs were not. And so you already were, and you were already providing your courses virtually online. But
Correct.
then you also saw a need for more in-depth training. Yeah, so can you talk a little bit about what that need was, like looking at, hey, we want more in-depth training, and how you made your decision in terms of how to get that training?
Absolutely. So, like I'd mentioned, our counseling department had incorporated telehealth training into its curriculum since our inception, which we're a fairly new program. Our department was created in 2017. But we discovered TCI and compared it to our previous vendor, and the benefits of switching were clear. Specifically, TCI offered training specifically in telemental health counseling, which is kind of hard to find. You'll find some telehealth training, and because we're positioned in a health sciences center, we're a more medically focused university. So a lot of our training was very general. It was telehealth or telemedicine that was general and it just didn't dive deep enough for telemental health counseling. And when we were looking into vendors, we found that TCI's training is one of the approved trainings for the board certified telemental health provider credential through the National Board of Certified Counselors. So also, because our program is online and we have students from all over the country, we needed a program that was flexible and online. And so the self-study telemental health training certificate program was really just it met our needs just from the surface. This was not having any experience with you all or the training itself. And since then, now every single one of our graduating students completes this program, completes the THTC certificate program. So those were the primary reasons why we decided to go with TCI. However, once we began the process, I was personally blown away with my experience because the in higher ed, getting a new vendor, the red tape, it can be a little bit challenging, but this process was incredibly smooth, and I attribute that to y'all's staff. Every encounter that I've had, whether it was on the phone, through email, through a Zoom call, was just incredibly positive. Everybody was responsive, kind, and really easy to work with, which is a pleasant surprise often when you're dealing with new vendors. So we were just really, really thrilled with our experience just from the get-go. And in fact, because our experience was so positive, our department approved all of our faculty to complete the training as well. So not just our students, but every faculty within our department completes the THTC certificate program. And then anybody that we onboard, any faculty member that we onboard since is going to complete that training. And I think that personally going through the training, if you're going to require it for students, you need to know what that training is. And all of my faculty are just impressed with the quality of the program. And for online faculty, we can be somewhat critical of online training programs. And we were just blown away. I think that the quality and care and attention to the program itself, the depth of the content that's covered, was just really exactly what we were looking for. And then something that was a surprise to me was the continuing education that's offered, not just through the certificate program that we purchased and that we went through, but also through the platform. I went to some webinars. I know that you had a virtual it wasn't seminar, but it was the word is evading me right now. But
Our
it was
summit.
Yeah, your summit.
Okay.
And
Yeah.
I just, not often do you get pleasantly surprised by a purchase that you make and a vendor that you engage with. Usually they kind of meet your expectations or are slightly below. Very rarely do they just kind of blow you out of the water. And that's really been our experience so far, is just quality and the people. So the people in every interaction that I've had, whether it's a question or a concern that's coming up or anything like that, it's quickly addressed and clearly addressed and with kindness. I think that so often now, because a lot of us are either working from home or we're doing a lot of virtual interactions, much of the human interaction can be missed. But I haven't run into any of that with any of your staff. And so I just want to thank you all for allowing us to be a part of this journey. It's really been a positive experience for us.
Yeah, that is like the best thing to hear. So thank you very much. Yeah, that's, you know, being a professor yourself and the director of the program, like, you know, we put so much work into that, and customer service is very, very important to us. So we want everything to be very practical, everyone to get their needs met. So it's really good to hear that people are experiencing it the way that we're hoping. Yeah, so that's fantastic. So in terms of a graduate program, I know other graduate programs, I think sometimes think, well, should we do telehealth training just in-house with our own faculty, or should we outsource it where, you know, it's going to be up to date? It's going to be, you know, telemental health can be quite technical, the legal aspects of technology, it's constantly evolving. So how to make that decision. Can you speak to that at all?
Yeah, I think it's probably an initial reaction that you do want to do it in house. One, because you might save a little bit of money. You can kind of control and really be intimately familiar of what the content that's being delivered. But here's the thing: unless you are going to commit to staying on top of the ever changing uh, kind of world of telehealth and telehealth practices, particularly with telemental health, you're probably going to be behind the curve every time. And so that was why we were comfortable with outsourcing it, because we wanted to give it to the experts. We by no means report ourselves to be experts in this. While I believe we're knowledgeable, it is too big of a topic and too detailed of a topic to get wrong, or to lag behind what's necessary. And so for us, it was kind of a no-brainer. It made sense to us. In addition to it being an approved program for the board certification, that is, I think, the best benefit to students, is because after they graduate and get licensed, they can sit and get a whole nother credential that if we were to do it in house, they wouldn't have that opportunity. And so for us, like I said, it didn't make sense for us to keep it in house because of the benefits that outsourcing it to you all as a vendor served for our students. And so I think also it being a quality program and seeing all of the attention. We were speaking before the interview started about the study guide and the review guide and those types of things that if we were to do that in house, that would be a full-time job for somebody. And we just don't have that luxury right now. And even if we did, it's still not. I believe that you have to give respect to this type of modality, and handing it over to a third party vendor who focuses solely on this and who has been identified by a national board as an approved training program, that just makes sense to us.
Yeah, that definitely makes sense to me also. Yeah, and I know sometimes universities struggle with the decision in terms of how should graduate students complete the coursework. Should they complete it, piecemeal during different courses that they take throughout their program? Should they do it during a practicum, uh, or should they do it on their own as an online self-study and then discuss what they learned in class, or should it be presented in class? And any thoughts on that?
Yeah, I think that it really depends on the program itself, what they have, what their options are as far as incorporating it into a curriculum. Currently, we have it before practicum. We have it sequenced before practicum because we know that many of our students are going to have some form of telehealth or telemental health interaction. So we don't want them learning it in practicum. We want them to have already had that skill beforehand. So as far as sequencing or when to put it in the program, definitely before clinicals is what I would recommend, simply for the fact that the students are more prepared when they actually utilize and apply this. Now, as far as if it should be broken up or in one kind of grouping, I think that depends on the learner themselves or how the program might see the curriculum. But for example, with this, I like the self-paced study so that they don't have to complete it all in one sitting. They can still complete it within the scope of a semester, but I think it needs to be kind of compiled in at least one learning semester so they're being able to build upon it. If it's two separate, you might lose the connection amongst all the other things that a student might be learning within a curriculum. And so I like the fact of having it kind of within a semester. The way that we have it is we have it built within a course. We have it within our micro counseling course because it is, in our opinion, a form of a skill and technique. And so that's kind of where we placed it within our curriculum. And then we have it basically as an assignment that they have to complete within that course. Some other options that we've also considered is taking it out of a course and kind of having it as a standalone non-credit course as far as the curriculum goes, but then it's on their transcript. that they completed this coursework. So I think there's pros and cons to any approach that you do. But so long as they're getting the training, that's what matters most to me. Where it's placed or how it's broken up or when to do it doesn't matter near as much as them actually getting that experience and learning about it. But for us, we want it to kind of be at least consistent and cohesive as it is meant to be within the course as it's delivered as kind of a self-paced package, and definitely before they start clinicals. I think those two things are important simply because you don't want them learning it as they're trying to apply it within their clinicals. And then you don't want it so spaced out that they don't understand that the legal aspects that they may have learned early on, and then at the last of it is synchronous techniques, all of that goes together. And so having it too separate, they might lose the connection. So a long-winded answer to your story is, or to your question is, we integrated it into the course that we feel it fits most, which is our micro counseling course, but we're exploring other areas. But we do believe that it should be completed kind of as it was intended and designed, which is sequentially self-paced. In one given semester. So that's kind of how we see it. But again, I'm no expert on how others should do their program. It just seems to fit in how we've sequenced it within our program.
Mhm. Yeah, I think, if I was a graduate student again, it would make sense to me that way, where I would get all the information that I need in a cohesive way around telehealth so I can put the pieces together. Yeah, and I like the idea of having it before practicum. One thing we notice a lot is that people will take our training and then they'll in their work sites, they'll notice things in their work sites that aren't done quite appropriately. Because a lot of people are having had to rapidly evolve into telehealth. So they had to kind of really launch quickly, and a lot of the programs may not have had adequate training themselves, or even the site supervisors may have not had. So sometimes the students going into the practicums, I would imagine, are a little bit of the expert in certain sites, clinical sites. And I would imagine maybe they come back to you guys. I know they come back to us sometimes and they say, "Hey, I noticed this, I noticed that." Yeah, so they kind of go in quite informed.
They do. That happens. And we try our best to try to vet our clinical sites as much as possible, that if they're going to be offering telehealth as a modality, that they have the necessary equipment, they have the necessary security, they have the necessary training. But there's a point in which you don't know the depth of it. Like you mentioned, people were kind of thrust into kind of creating telehealth as an option within their clinics. And so they kind of threw it together. Probably somebody might have gotten trained, or they're trying to get trained as they go. So in many cases, yeah, the students are going into it probably a little bit more prepared, a little bit more knowledgeable of best practices. But we haven't run into too much, at least now. Probably a year ago, there was a little bit of more of that happening, but at least now it seems like everybody seems to be more on pace with best practices and what's expected and what not to do. We have run into a couple of cases where a student's like, well, I'm being asked to do this. Is this the right thing to do? So say, for example, they may be asked to text a client. Well, if it's not within a platform where you have that option to do it, it's probably not ideal. You don't need to be handing out your cell phone number to your clients. But if you have a system where you can text through that system, that you have policies and procedures that kind of protect you as the student, then let's explore it. But our students at least know to ask those questions, to raise awareness around if they're being asked to do one thing or another, or if a client. So I have a student, I teach practicum right now, and I had a student who was doing a telehealth appointment, and the client was doing it in her car while she was driving. And we had to talk about, okay, well, what did your informed consent look like? When you agreed to these trainings, did you have, or did you, when you agreed to these sessions, walk me through kind of how you prepared the client for the expectations of that appointment. And come to find out, there wasn't a lot done there. So it was kind of a retrospective thing that she had to go to her clinical site and say, hey, can we add this in because I'm not comfortable doing a telehealth appointment via FaceTime while a client's in their car. And so the student knew that, hey, this isn't right, but we didn't really go over it. What do we need to do? So that's something that even though they may encounter these things and they may not know exactly how to approach their clinical site, they know that this doesn't seem right. And so they'll ask those questions and allow us to kind of intervene on their behalf, or if it is a safety or security issue, to really intervene as expeditiously as possible. But yeah, we do run into that, but not as frequently, thank goodness, now as we did previously.
Yeah, that's great. That's exactly what we want for students, right? We want them to be able to notice things that they need to investigate further, to notice when they have to ask questions and learn more, because we're like lifelong learners, right? Like constantly learning, constantly have to investigate. But knowing, with learning, it's like we don't know, right? But then it's we know what we don't know. That's key. So like,
Mhm.
I'm not sure about that. I need to investigate that rather than just assuming, this is okay, this is the way it goes. Yeah, I think that is key, because technology is rapidly evolving, all sorts of new possibilities popping up all the time. And I think that's the most important thing the students can learn, is like having a foundation of those essentials, that when these new things come up, you can go back to the essentials and say, okay, how do these line up? What do we have to ask and figure out here before just embarking on this new technology or process? That's great. Yeah, you all are doing a fantastic job. Is there anything you'd like to say about the program to anyone interested in looking at programs? Being online is super helpful, because a lot of times location is a barrier to someone entering a program. Anything you'd like to say about that?
I would say anybody that's considering integrating this telehealth training into their curriculum, is explore it. Just look into it, see the content covered. I mean, they've even since we started have added to the curriculum, and so that I think speaks to the quality and care and attention that the topic of telemental health counseling needs. And so I would encourage, whether it's an in-person program looking to integrate this self-paced online study, and I know that there's a live webinar version of it too. Whatever fits your needs and your students, it is a quality program. And when you think about the cons, there's not many at all. Because students need to learn this, and they need to learn it from experts who live and breathe this content, and they need to have resources to fall back on even after they graduate. And that's something that I think that, as much as we want to try to offer that as faculty, this is, like I was saying earlier in the interview, this is a full-time job to stay on top of this, and you want to give it to the experts. And so I get the hesitations, especially if you're not used to kind of an online learning environment. But I think thankfully, COVID allowed us to see that you can still get quality content. You can still deliver information in a rigorous way that makes it almost more digestible for students, because they can kind of break it up, at least for the self-paced study. I'll refer to that. They can break it up according to how they learn. And that's what we want. We want students to absorb this information, because like I had mentioned, it's not going anywhere. Telemental health counseling is not going anywhere. It's not going to replace in person, but it's going to be offered because it is one of those modalities. Behavioral health is one of those services that works really well with telemental health services, because we don't have to check vitals necessarily. And I get questions from my students all the time. Well, I've done in person, I've done telehealth, and I can get so much information from an in person visit because I can see their body language. I can see that. But then I ask them, okay, well, what if that client didn't come in at all? What would you be able to see? Probably nothing, right? And so a lot of times telemental health counseling offers the opportunity for clients to get counseling services that they wouldn't otherwise take advantage of. And that I think is the beauty behind it. And especially in those rural areas where traveling for 2.5 hours is just not feasible. And also what I tell my students is a lot of times going to counseling is daunting. It's a little bit overwhelming, and doing it through Zoom or through a virtual platform makes it a little bit easier because they can be in their space. They don't have to wait in a waiting room. They don't have that kind of stigma of pulling up in the parking lot and thinking, "Oh, who's seeing me walk into this building?" They get to do it from the comfort of their home. And so people that may not have taken advantage of counseling before may be more likely to take advantage of counseling now. And so, yes, if you compare it to in person counseling versus telehealth, there's going to be differences, but telehealth is not going anywhere. And so, for programs that are considering incorporating this into their curriculum, I highly recommend it. I can't recommend it enough because of just how beneficial it is for students, and then also the clients that those students will see. They have best practices, like you mentioned. They have a foundation that they can work from, to ask questions when something isn't right, or how to improve. If we just assume that counseling is an in-person type of service, we're really missing a huge component of the potential of reach of what counseling can offer. So I would highly recommend it. And if you're looking through potentially using TCI as a vendor, just reach out to one of them and you will know what I'm talking about. Just the customer service is just not like what I've experienced in the past. It's really impressive. So that I would say, just look into it. Dip your toe in that water and just try it.
Yeah. Well, Dr. Winkelman, thank you so much. That's a lot to take in, and I really, really appreciate it.